Vajival labate narana. Vrjet chapyatikam tena. Tena vajikarana which is pratam. When we go into the history, in the Ramayana, we get the history of Dasharatha Maharaja. He had no children for several years. When he conducted Putrakameshti Yaga, Sri Rama, Bharata, Shatrughna, Lakshmana like children are born by his different three wives. Similarly, we get the story of Dileepa Maharaja and Nandini. Probably Dileepa Maharaja, due to his taulya, due to his sedentary life as a king, as an emperor, probably had Pramehadi, Stula Pramehadi Vikriti. That's why he did the seva of the Nandini, and he was walking from his kingdom, from his palace to a mountain, regularly doing puja. Similarly, we get some information in Mahabharata too, where Chitravirya and Vichitravirya, their story comes. Acharya Bhishma, when he brings Amba, Ambika and Ambalika, Amba denied of marrying everybody, and there was a war between them, Bhishmacharya and Amba, the first one, whereas Ambika and Ambalika were convinced by Satyavati Devi, and later on, Chitravirya and Vichitravirya were the two sons, out of which Vichitravirya died out of his Rajeshma like Vikriti. Probably it was Chitravirya, and later on the various issues and the deponents like Pandu, Pandavas, followed by, and Kauravas from Dhritarashtra were born. Likewise, in Purana, in various Samitas, various historical aspects, we get the background and information of Vajikarana Shastra. Shukra Dhatu is the Saptami Dhatu. From the Rasa onwards, up to the Shukra, the Dhattvagni Vyapara, and finally, formation of the Shukra Dhatu, Prashanth Mamsa Medo Asti Majja Shukrani Dhatavaha. So Shukra Dhatu is the ultimate one, the final one. From there, the Ojas is derived. Shukra Dhatu is from the Sthai and Asthai Bhaga of the Majja Dhatu, wherein the Poshaka Bhaga and Poshya Bhaga is separated. Asthai Dhatu go to the Shukra Dhatu and nourishes that. There also comes Shukram Garbha Prasada Jaha, and Shukra is the Garbhotpadaka Hetu also. It is the Bija, it is the Bija Bhagaveva. Acharya Charaka speaks regarding the different components of the Shukra, wherein Bija Bhagaveva, the theory of the chromosome, theory of the genetic inheritance, genes, etc. also comes here. The body, the tail, and head. Usually, our Vriddha Vaidya says that Shukra resembles just like a sarpa, a serpentine, which is having a head and a body, a tail like. Similarly, we do the worship of such different animals and creatures. Shukram, Dhairyam, Chavanam, Preetim, Dehabalam, Harsham, Bijartam cha. Shukrasara Purusha. Shukra will bring about lot of potency, virility, vitality, Dhairyam. Because the aldosterone content, the testosterone content are known for Shaurya, Dhairyam. Chavanam, Kanti or the luster, Yuvavastha, adolescence characters, pubertal characters, Yuvavastha, adulthoodness, they are all derived from Shukra Dhatu. Preetim, Saumanasyam Garbha Janakanam Sretha. Acharya Churaka, in the 25th chapter, Yajna Purushiya, says that Saumanasya is very much required for the Garbhotpadana. Similarly, Preeti, love and affection. So where Sharangadara says that Strishu Jato Purushanam Strishwapi Paraskara Kritasneha Kama Ityavidiyate. Strishu Jato Purushanam Strishwapi Paraspara Kritasneha Kama Ityavidiyate. That is Preeti. So that love, affection, the interpersonal relationship between Pati Patni, husband and wife is a very, very important factor. Wherein nowadays lots of cases are happening because of the extramarital affairs, because of the marital conflicts, and lot of cases are pending in different courts. So due to the law issues, Dehabalam, Dehabala is the Dhardyata, Dehabala is the vigor and vitality. And once if there is Shukra Kshaya, so there will be Balakshaya. That is why in Raja Yashma like conditions, patient loses his body weight. Shoshi Munchati Gatrani, Purisha Samsanadapi. And by the Bindunasha, by the Shukranasha, by the Vilomata Kshaya, Rajayashma, the Vikrits are possible. That is why Maranam Bindu Patanat, Jivanam Bindu Dharanat. Likewise, in Yoga Shastra, there is a reference. Dehabalam, Harsham, that will bring about enjoyfulness, joyfulness. That is why the karma of the Upastendriya is Ananda, happiness, that will bring about enthusiasm. So every creature in the nature has got that tendency of getting progeny. And if any animal is disturbed at that particular moment, there are crimes happening. Bijartamcha, it is going to help the pregnancy, going to induce the pregnancy. In that way, Shukram, Dhairyam, Chavanam, Preetim, Dehabalam, Harsham, Bijartamcha has been spoken in the Shastra. Further, Pramana of the Shukra has been told as Ardhanjaleha. Shukrasya Ardhanjaleha. Ardhanjali means what here? Maybe about 2 to 5 ml, definitely. But whether the quantity of the semen, whether the Rupadravya, its Pramana is very important in the pregnancy, sometimes we have to say yes. Why? Because if there is Kshaya of the Shukra and if there is very much a condition called as anejaculation is taken place, no question of pregnancy will be there. In that way, Pramana of the Shukra is very important. Sometimes, if there is a Pramana Kshaya of the Shukra Dhatu, because Shukra Dhatu is basically derived from Ap Mahabhuta and Parthiva Tattva. If Ap Mahabhuta is reduced, Saumyamsha is reduced, quantitative reduction of Shukra is possible. Ardhanjaleha Shukrasya. Then, by the Prayoga of the Kshira, Tatra Sadhya Shukra Karam Payaha, by the Prayoga of the Kshira or by the Nitya Prayoga of the Kshira Gritabhyasa, Nityam Kshira Gritabhyasa Rasayananam Sreshtaha. By that, there is increment of the Shukradhatu, immediate nourishment of Shukradhatu, and Pramanata, the Shukradhatu is manageable. In that way, the quantity of the Shukra is very, very important. Though in the Western system of medicine and in the reproductive biology, regarding the quantity of semen, no much importance has been given. Ayurveda believes that Shastra and Siddhanta, with the very reason that we have the great concept of Shukra Vriddhi and Shukra Kshaya. By the Shukra Vriddhi, there are different lakshanas told by Vagpata, that is Atikstri Kamtam, etc. By the Shukra Kshaya and Chirat Prasicheta, like findings are observed by a patient. Hence, Pramana of the Shukra Dhatu should be looked into. In anal ejaculation condition, when there is no Shukra Pravartana or in retrograde ejaculation, once again, the possibility of ejaculation comes down or proper ejaculation doesn't happen, then we have to talk about again the Pramana. So that Shukra, its Pramana is Ardhanjali. As per Bhera Acharya, it is 1 Anjali Pramana, Ekanjaleha. So that quantity of the Shukra in the clinical medicine or in the reproductive biology do have very importance. That is why Shatavari should be spoken as the most important dravya for the Shukra Vardhanartha. Yasmat dravyasya Shukrasya Vriddhi Syat Shukralam cha taduchyate Yatashvagandha Musali Sharkara cha Shatavari. Now Shatavari, it is called as Bahala Rasa. Shatavari is Tanya Janaka, no doubt. Shatavari is going to increase the prolactin content. Shatavari is also Rasadhatu Vardhaka. And Shatavari is Madhura, Snigdha, Pichila, as well as Shitavirya. All the important Gunadharma, because we have to speak about Gunavijnana here. All the important gunas of whatever the Shukra is having, that is there in Shatavari. If there is a Pramanata Kshaya of the Shukra, then we have to administer Shatavari Prayoga. Shatavari along with Sharkara. Shatavari Siddha Kshirapaka. Shatavari Kshira and Sharkara. That is why Sharkara Kshira Sarpeshi Sarvesham Vidhi Brahmanam. Like that in the Brahmana Adhikara it has been spoken. When we go into the concept of further Shukra Dhatu, its Varna is Patikaba, it is crystal clear. We will have Varna Vikriti in different areas. For example, in Dosha Dushita Shukra Prakarana, when a Pitta Dushita Shukra Purusha comes, Puti Gandatva, and the yellowish discoloration, presence of pyogenic bodies, in Rakta Dushita Shukra, presence of the blood, RBCs, or when in the presence of Purisha, etc., can be seen in fistula-like conditions, rectal or the rectovesical fistula-like conditions, you may see the Varna of the Shukra is impaired. Depending upon the dosha influence, Varna of the Shukra varies. So in such a way, we have to treat the condition, apply the applied physiology, understand why this normalcy is very much required. It is Patikabham. It is Patikaba, a crystal-like, clear, whitish, Grutavat, that indicates the viscosity component. That also indicates its Mandatva, its Snigdatva. So the mucopolypeptides or the Snigdata, Yasya, Sandhane Shakti is the Sneha, Sneha Guna Pradana, Snigda Guna Pradana, Grutavat. So it will appear just like Gruta, or Grutavat, it is Madhura, Grutavat, it is Shita, Grutavat, it is Madhura Vipaki. In that way, Madhura Rasatmaka Gruta is going to nourish the Shukra Dhatu. In that way, Taila is Sara in nature. Shukra Dhatu has got a tendency of motility. Now, motility factor of the Shukra Dhatu or the spermatozoa comes due to Vata dosha, especially Vyana Vayu. Vata is Chalagunatmaka. Now Shukra Dhatu is Saragunatmaka. So Taila is Sara. Whenever there is Saragunatmaka Vikriti, Chalagunatmaka Vikriti, motility defect comes, then Taila Prayoga has been told. So Taila Prayoga in the form of Pana, Taila Prayoga in the form of Vasti, like Matra Vasti or Anuvasana Vasti, should be encouraged. There are different Taila Yogas told in the Vajikarana Shastra, like Ashwagandha Tailam. Likewise, Gokshura Siddha Taila, Gokshuram Vriksham Vataharana. Gokshura is the important medicine that is acting on the reproductive system, genitourinary system, because in olden days, in the anatomy, we have been understanding genitourinary system as a combined system. Whereas after further development, genital and the reproductive system, the urinary system, they are separated. In that way, Taila, due to the Saragunatmaka nature, Gokshuradi Taila, Gokshuram Vrisham Vataharanam, Erandam Vrisham Vataharanam, there are different Eranda Snehas, Eranda Kalpanas given for the Saraguna Vritti. If the Saraguna is impaired, that is why Taila is important in the Vajikarana Shastra, how we have to apply the Guna Siddhanta, because there is a motility defect. Until and unless there is a motility defect, you do the Taila Prayoga. Taila is Sara, Vata is Chala, so you will do the Vatasya Upakramam by the Taila. Kshamudra Nibham. Now, the Kshamudravat, it indicates the smell and also indicates its component, that is consistency. So, Shukra is Patikava, is Gratavat, Tailavat, and Shaudra Nibhavat. It is Drava in nature because of Mahabhut and Saumya Dhatu Pradana. It is a Kleda Tattva in the body. It is a Dravadhatu in the body. Hence, it is Drava in nature, the fluidity, seminiferous fluid. So, the component, as discussed earlier, why the Pramana is important. Sometimes the very much large quantity of the semen, if it is ejaculated, whether that is going to help in the pregnancy, probably the answer comes, there is no answer or no. But when we look into the Vatadushita Shukra becomes Tanu, Alpalpam Va. Alpalpam Va indicates quantitative reduction of the semen. If there is a quantitative reduction of semen, that indicates Vata dosha due to its Kharatva, due to its Virukshana Swabhava, due to its Upashoshana Swabhava, it is drying the semen. There is Shoshana, Upashoshana of the Dhatu. That is why in Rajayashma Prakarana, Vilomataksha is spoken by the Atip Maitunadi, different Hetus. There is Shukrakshaya, further leading to Raktabhigamana, and patient will be getting the Rajayashma or today's different conditions like HIV, AIDS, etc. Wherein Shukra Dhatu is pitcha in nature. The pichilatva indicates the viscosity component. Sometimes patients brings a report saying that, see doctor, after a history of married life of 10 years, though my partners, every parameters all right, the follicular study is wonderful, the uh, tubal patency is all right, every report shows perfect, my count is also very correct. I'm not getting any answer why the pregnancy is not taking place. We have to then study whether the pichilatva or the snigdatva viscosity component is increased. Definitely, nowadays, when you speak to an infertility specialist or a surgeon who handles this case, viscosity component, yes, delayed what liquefaction time, liquefaction of the semen attains after 90 minutes, liquefaction of the semen attains after 2 hours, then where is the question of pregnancy? So we need to encourage such an viparita dravya which reduces the pichilatva, which brings down this snigdatva, like bhallataka prayog has been told here. Bhallatakani tishnani pakini agni samanicha. Bhallataka rasayana is vajikara. Bhallataka is madura, ushna, and it is pachana. Asya pachana is shakti sasvedaka. So in that way, the pichila snigdaguna, viscosity component, should be understood. Viscosity component, if it is increased, what is the answer? Viscosity and fluidity decreased, what is the answer? By the Ekamunika Dravya Prayoga, probably we will be managing very, very successfully all these parameters. It is Bahala, definitely the quantity of the semen. By that, there will be a satisfaction. There is a target, orgasm is achieved by both partners. So, Baharatva is that particular psychological parameter very much required for the achievement of the orgasm. It is Bahu, definitely when it is discharged, again it is produced. It is Bahu, and it is Sara, as discussed earlier, the motility factor, in which whether all these spermatozoa they are motile, or whether some immotility problem, whether some motility disorder is already there, like that we have to calculate, we have to do the semenogram and appreciate it. Its taste is madura, that indicates the level of the fructose component, so that Nityam Kshira Gratabhyasaha, Sharkara Kshira Sarpishi, Sarvesham Vriddhi Brahmanam. So Madhura Rasa is the very, very much inseparable form in Shukradhatu, that is in Avinabhava Sambandha, in Samavaya Sambandha. So that if suppose a patient indulges Ksharati Seva, Katukati Seva, Ushnati Seva, Tishnati Seva, the Viparita Dravya of the Madhura Rasa, especially the Katukati and Ksharati Seva, what is going to happen? Patient will be getting a reduction in the semen volume. Patient will be getting towards oligospermia, and patient may develop some other seminal problems. So Madhura Rasa definitely should be required. But when come to a question of Madhumehi, when come to a question of a diabetic individual, whether this particular Madhuryata is going to contribute, whether all the Dashadushas involved in the Prameha Rogadikara are going to involve in the infertility? If you ask the question, definitely yes, because Stula Rogis or Medo Rogi and in Madhumeha, getting a progeny is a difficult task. As well, in the Stauladikara, Aharshana has been told as one of the Lakshanas. When we go to the smell parameter or its Gandha order, it is Abhisra or Madhugandhi. That again indicates its normal physiology. If there is an abnormal Gandha in the form of Puti Puyanida Nibagandha or Amla Gandhitva, because if the pH value of the Shukra is increases towards acidic one, then Amla Gandhi Shukra is also possible. Of course, when we examine this Shukra or the semen in the laboratory, a lab technician, once he was telling, this semen or this particular sample is very much badly smelling. It is smelling just like an acid. Then I immediately thought, yes, it is losing its normal Gandha. Then if the patient is getting some Pitta Dushti Lakshana, if definitely Pittasya Upakrama like Virejan is carried out, if Gratak Prayog is carried out, definitely the patient is going to improve. As well in Madhyapa, in smokers, as some of the Varna Vikriti and Gandha Vikriti is observed in the clinical practice. Then when we look into the Guna or its density, it is Guru and Sandra. Guru and Sandrata, that indicates it is heavy. Means when we examine the Shukra Dhatu, put into the water, it is going to get immersed and it is Sandra, it is accumulated together. Gradually, its vilayana takes place. That indicates soon after the ejaculation, it is Gradita. Gradually, when it is exposed to the temperature, it is liquefied. And after a certain duration, it is liquefied. Then the motility factor comes. So, Sandratva, Gurutva parameter, Sandra and Guru. So, we need to treat the condition. Sometimes, if the Shukra, if it is Tanu, and if it is excessive Drava, immediately after ejaculation, that becomes watery. In such a patients, motility is reduced. In such a way, we have to go for the Vatasya Upakrama. Because of the Vata overshadowing, because of Vata Dushti, now patient will be developing these particular problems. Then what is the answer? Definitely, it is Maitunajanam, Vikaranam, Visheshatu, Kshira Sarpichur, Upayoga, Sayapanaha. So in Maitrajana Vikriti, it is the prayoga of the Kshira and Sarpi. Kshira is Madhura, Kshira is Sandra, Kshira is Jivaniya, Ojo Vivardaka, and Paramashukra, Kshira Grata Vyasa, and Nita Kshira Grata Prayoga, so that Grata is Madhura, Grata is Pichira, Stigda. So we can overcome all these problems by Guna Siddhanta. Definitely, our Acharya, their visions were wonderful at that time and more scientific. Shukra Utpatti takes from the Panchamahabhuta. Shukra is derived from the Saumya Dhatu, Jaliya Tattva. That is why fluidity component is very, very important. Production of Shukra is from Ahara Rasa, Sadhya Shukra Karampayaha, and by the Kshira Dadi Nyaya, by the Kedara Kulya Nyaya, by the Kaloka Kapota Nyaya, and Ekakala Dhatu Poshana Nyaya, as well by the Sahasra Patra, Suchi Patra, Veda Vidinyaya. We have to understand where is this theories. Kshira Dadi Nyaya said that how from the Kshira, the Dadi, from the Namanita, then it is Grita, like extraction takes place. Similarly, from the Rasa, then the Rakta, the Tarotu Dhatu Vardhana, from the Majja Dhatu, from the Poshaka Bhava, further there is nourishment, Utpat of the Shukra Dhatu takes place. All right. It is Kedara Kulya Nyaya. Yes, at a time, all the Dhatu components, they will be taking the nutrients. Yes, that's all right. By the prayoga of some of the Vajikara Dravyas, some of the Dravyas like Musali, you will see the immediate effect. By the prayoga of the Ashwagandha, the immediate orgasm and stimulation is noticed. Once if there is Samana Vata Vyapara, Samano Agni Samipastha, Kote Charati Sarvataha, Annam Grannati, Pachati, Vivechati, Munchati. So in the Shukra Pravartana, especially in the Shukra Dhatu Utpadana, Pachakagni Vyapara, the involvement of the Kledaka Kapha and contribution of Samanavata definitely plays a major role. Why? Because in metabolic disorders, Shukra Dhatu and its variation take place, especially in thyroid problems, endocrine issues. So hypothyroidism induced infertility, hypothyroidism induced various obesity issues, hypothyroidism induced semen defects or infertility problems. In that way, Kedara Kulya Nyaya, wherein Pachakagni Vyapara, definitely the influence of Samanavayu and involvement of Kledaka Kapha should be understood from the Kedara Kulya Iva, Yatashetu Mado Avadharya, Aparena Udakena Vyamisri Bhavaha. In the Sushruta, that Siddhanta should be understood well here. Kalaya Kapota Nyaya. Some of the Shukra Dravyas, some of the Aushadha Yogas, they will be carrying the nutrients. The nutrients are directly carried to that particular sotas. For example, when we go to the Pandu Chikissa, when we do the prayer with the Mandura, now this iron composition, ferrous molecules directly nourishing the Ratta Dhatu. Similarly, when the Mamsarasa is given, Mamsam Mamchena Vardeti, Mamsarasa is going to nourish the Mamsa Dhatu. Similarly, when we give the Nakrarita, of course, it may be a theoretical part here, but Vastanda Prakarana, Vastanda Yoga by Yoga Ratnakara and other textbooks. So here, Vastanda acts the Anda of the Aja or Avika. It should be separated well, it should be cooked well, and there are different procedures. So in our practice setup, we are giving Vastanda Yoga. The very, very important theory is that Yatha Brahmande, Tata Pindande. What is there in an animal, what is there in an universe, that is the same is happening in the body also. When this is given, the testicles, gonads are cooked well in Kshira and some Prakshepa Dravyas are added, it is going to enrich the Shukra Dhatu component, Kale Kapota Nyaya. So Kale Kapota Nyaya is very important here. That is why Suchi Patra Veda Vidin Nyaya has been spoken by the authors. So if you give a Vajikara Dravya, there is an immediate drainage, that is Kapikachu, and the Kapikachu or water is given, that is going to happen. So in that way, the applied physiology, understanding of where these phenomenon come into the practice setup is the need of our physiological stages of the Shukra formation. How Shukra Janana is taken place from the Majja Dhatu, and it is the Saptama or end of the end Dhatu. Shukra Pravartana is attaining, it is the Rupa Dravya. Further, when we look into the Gunadharma of the Shukra, Snigdam, Ganam, Pichilam, Maduram, Cha Avidahi Cha. Shukradhatu is Snigda. It is Ghana, it is Pichila. Already regarding the Snigdhata we have spoken. It is Ghana because the immediate moment when it comes out in the form of an ejaculum, it is Ghana, solidified. And when it is exposed, gradually it is liquefied. Pichilam cha Maduram cha Avidahi. This Avidahi character is a very, very important component. Sometimes the married couple comes. See, doctor, recently I got married. My problem is very severe burning sensation in the urethra, in the genital organ, the penile organ. I am getting this particular vidaha, burning discomfort. The same is complaint is given by the partner also. Female partner will tell, doctor, this is the problem. Soon after the copulation, there is vidahatva, burning discomfort. Then we have to definitely infer pitta dosha. It is the causing the problem. Reta Shuddham Vijaniyat Svetam Spatika Sannibam. So this Retas is Vishuddha. Then it is possible to get the pregnancy. Shukra Vritti Lakshana has been spoken by our authors, especially Acharya Vagbhata contributes much in this regard. Atistri Kamatam Vriddham Shukram Shukrashmarimapi. Atistri Kamatam. We had a few cases. One particular case I want to say is pheochromocytoma, a tumor in the adrenal gland. This particular man had a problem later on, that is exhibitionism, and the moment he sees some Sri or any other opposite sex people, he is getting arousal. He is in a position to unable to control in a position. So atistri kamatam, probably the endocrine issues comes here. And Shukram Vruddham Shukrashmari Vapi. Shukrashmari, why it is? Definitely, when we go to the patients of varicose seal, varicosity of the pampiniform plexus, in the Keli Kutuhala, there is a reference of Hastamaituna. Now, though the direct reference of the Hastamaituna is not available in detail in our Shastra Granthas, Ayonigamana has been told here. Probably by that particular cause of Hastamaituna or masturbation, etc., incidence and morbidity ratio of Shukrashmari, which is nothing but a varicose seal, just like a worm bag appearance, is found. That is one particular area. Another particular area, Shukradhatu becomes highly viscous. Seminiferous fluid becomes highly viscous. Already discussed, it will be taking a longer duration for the liquefaction. After 2 hours if it is liquefied, then no hopes of any pregnancy. In that way, Atistri Kamatam Shukram Vruddham Shukrashmarimapi. And Shukrakshaya Lakshanas are also spoken, definitely seen in different cases when they come to the clinical setup. Shukre Chirat Prasicheta. In a married couple, especially nowadays, the stress phenomenon is a very great problem. Usually in the IT sector, we doctors face the situation that young adults, couple will be coming on every Saturday and Sundays to the clinics. Doctor, can you spare some time? Online booking they will be taking. What is the problem? See, all 5 days we are stressed. We want to enjoy the end of the week. On the weekends, we are again getting more and more stress. My husband is forcing me towards sexual activity during menstruation. And when I am getting migraine headache, again he is forcing me. So that Shukre chirat prasijjeta. There is an influence over the male partner. Psychological phenomenon, depression. Shukre chirat prasijjeta. Again, aging factor. Everybody in the society nowadays, everybody looks into the education. Education first, sex next, qualification first, marriage next, employment and job is first, marriage and children are next. If this sutra is paripana is made, then ultimately by the end of 35 years, 45 years, the marriage happens. Then the very immediate problem that comes is Shukre Chirat Prasijjeta. Doctor, there is an erectile dysfunction. There is a problem of ejaculation. Of course, the arousal I am getting, the arousal is happening, and both are getting unhappy, and both getting diverted, and ultimately there is a huge cry in the night. Night cry happens. Shukre Chirat Prasijjeta. In Shukralpata, in Shukrakshaya, there are some certain drugs that induce Shukrakshaya. Shoshanech Haritaki. And by the prayer of the Nimba also, Shukrakshaya happens. Because Nimba is Ruksha, Nimba is Tikta Kashaya, Nimba is Krimigna, Nimba is causing Upashoshana. Then continuous intake of the Nimba Kashaya, continuous intake of Nimba Prayoga, and in many patients of the Kamala Roga, we advise and advocate Nimba Kalpanas. So Nimba Kalpana will reduce the quantity of the semen. We appreciate it because what happens is some Vritta Vaidya says don't give Nimba Prayoga for a longer duration. There are some adverse reactions. Then later on, by the practical knowledge, I came to know definitely this is happening because some of the patients, when we did the follow-up, this was the problem they have been facing. Shukre Chirat Prasijjeta. Shukram Shonita Mevama. This Shonita Mevama, hematospermia, along with semen, presence of RBCs, along with semen, presence of blood, frank blood comes out. Definitely, the patient is under panic situation because in the night he can't go anywhere and he is in a depression mood. In the morning, he will be calling the doctor, this is the problem with me, I want to consult in the early morning at 6 o'clock, a telephone will come. Then when we address the patient, see doctor, my bad story yesterday night, this happened. Why? Probably the reason Shukraksha is happening. And in the penile region, there is an ulceration or there is a rupture that happens sometimes, hematospermia. I had a case immediately came from Davangere, a nearby city of Hubli, wherein a patient was complaining repeated presence of RBCs, the blood in the semen. Then I thought definitely Vagbata, thousands of years before, he told this particular prakarana, Shukre Chirat Prasijjeta Shukram Shonitameva. Then some patient comes with varicocele or herniation. See doctor, after copulation, I am getting pain. And only weekly one particular copulation we are practicing. Even after that, there is a pain. Todo atyartam vrishanayoho, testicular pain or scrotal pain, scrotal sac, there is todavat shula, vedavat shula, etc. Dhumayati vacha. This particular burning sensation indicates there is a pyogenic infection. That also indicates pH value. I was talking about an infertility specialist, whether the pH value of the semen parameter, the pH value of the vaginal fluid is very important for the infertility and fertility index. Definitely, we have different ksharadravya's, we have different vasti kalpanas, we have different taila prayoga, krita prayoga to overcome this situation. Dhuma yati vacha, burn, discomfort, severe burning sensation immediately after ejaculation or during ejaculation because of urethritis, because of anterior urethritis, because of bulbar problems that happens, and probably in ascending urinary tract infection as well as in some of the STDs. This is one of the situations. Shukre Chirat Prasijjeta Shukram Shonitameva Todovatirtam Vrishanayo Metram Dhuma Etivacha. Vagbata was 100% practicable at that particular situation and moment. Now, when we go to the Panchabautika Siddhanta of the Shukra Dhatu, and that's also very important as far as the treatment is concerned. Panchabautika Tattva, what is the influence of Vayu over Shukra? Definitely the Shukra Pravartana. Apano, Shukrartava Shakranmutra, Garbhanishkramana Kramaha. Shukra Pravartana is only possible when the Apana is intact. In diabetic peripheral neuropathy, in patients of intervertebral disc lesion, in sacral plexus injury, if you look into the patient, erectile dysfunction Dvajabhanga, like various issues are addressed. Then, if the Apana Mata is not functioning properly, because the sensory area in the posterior horn cell is damaged in all these different situations, patient will be facing the problem. Vayu, which is Chalagunatmaka, there is Avarana, and Vayu is getting hindered, Avaroda, and Gatikarma, there is a degeneration. Vayu, we have to think about Vyana Vayu also. Why Vyana Vayu? Vivecheti. Shukradhatu, its Utpadana, its spermatogenetic activity, and further its division, and various parts like tail, body, head, etc. are formed by the Vyana Vayu. Again, the Chalaguna, that is the motility factor, Vyana. So, influence of Vayu, like Panavata, directly, Vyana Vayu, already discussed Samana Vayu at the level of the metabolism, Udana Vayu, as far as the higher mental functions are concerned, the cerebral cortical activity is concerned, Prana Vayu, so Vayu, Agni Mahabhuta, yes. Now Shukra Dhatu, always for its motility, energy is required. Moreover, Pitta dosha has got its own influence, Tejo Tattva. When we look into the temperature, our testicles, human beings' testicles are descending out of the body. Why? It should not be inside the body. Nature has got its own balancing phenomenon. If it is inside the body, then definitely spermatogenesis cannot occur. It has got its own temperature control. With a particular temperature control, it is going to get the spermatogenetic activity by the blood supply. That's why Agni Mahabhuta. Jaliya Tattva. Here it is Abdhatu or Udaka Tattva, fluidity. Parthiva Tattva, every tissue and the cells of the Shukradhatu. And ultimately, what is the role of Akash Tattva? Akash Tattva, again, Vibhajayati, for the different millions of the sperm bodies are seen in the over this one seminal fluids. Out of that, only one particular sperm which is active and clever. I want to address the word called as clever here. Clever and active. Just like an athletic event taking place, speed, velocity along with the cleverness. Means it will catch the ovum and pregnancy is induced. In that way, every Panchamahabhuta has got their own role in the manifestation, in the Utpadana of the Shukradhatu and Panchabhutik combination. Over the Panchabhutik Tattva, again the treatment plan should be made. Further, Sushruta says, including the Akash Tattva, there is a role. Prithvi Tattva has got a Dharana Samarthya. So, semen should be getting holded in the body for a particular age, and gradually there is Shaitilya after a particular age. So, the different aging factors as per Sharangadara, Namajata Shishu from their Balyavastha, Yuvavastha, Praudavastha, and so on. Samhanana, binding capacity by the Jala. This Nehaguna and Jaliya Tattva for the binding agent. Shukra Tattva, it's a fluid and inseparable form, binding agent. Parinama, it's metamorphosis, conversion from the spermatogenesis. Later on, all the other different developmental aspects. Then Vayu is very much required for its movement. Akasha Tattva, from one Shukradhatu, from one particular spermatic body to the another, there is a space, what is called Akasha Tattva, Avakasha Yukta Bhaga. In that way, every Panchamahabhuta, all the Panchamahabhuta, they got their own role in the Utpadana of the Shukra. According to Acharya Charaka, Shukra is the Pitra Jabhava, no doubt. Testosterone content, aldosterone content from their production of its mala, Shukradhatu mala, Ojas, Smashru, Romadi, different areas. When you look into what is the influence of the Kapha over Shukra, it is divided, classified under Kapha Samana Dhatu. All the Panchabhuti principles, especially the Partha and Apriya Tattva, is predominant. It is the Ashrayasthana for Kapha once again. As well, from the Rasa, Shukra is produced. Rasa is Madhura, Shukra is also Madhura. Rasa is Manda, Shukra is also Snigdha. Like that, the Utpadana, different characteristic division, attribution of the Shukra has been spoken, and Shukra is the very much vital area. That's why it is called as Pranayatana. Maranam Bindu Patanat, Jivanam Bindu Patanat. Vitapaparma Arbihata, like areas are addressed in the Shastra. Brahmacharya Paripalana for certain extent, Brahmacharya also by Vagbata. All these areas of Trayopasamba and practice of the Grahya Dharma in Ayurveda, very well it is discussed. Spatikabam Dravam Tigdam Maduram Madigandicha Shukram Ichanti Kechit Taula Tairak Shaudan Ibam Tata. In a nutshell, Vagbata speaks about how Shukra Dhatu should appear and what is the Guna influence, what is the Rasa influence of Shukra, and how it is Tailavat, Kritavat, and Kshadravat. Yes. That indicates Shukra Dhatu should be examined properly in the laboratory. If at all a problem comes with parameters of the Shukra, Dushti is taken place. When we move into the Shukra Maha Srotas, Shukra Mahanam Srotasam Vrishana Moolam Shefascha. Vrishanas, testicles. Shefascha, penile organ. No doubt. Acharya Charaka says in the Vimanasthana. Further, Sushruta is little bit different. Stano Vrishanam cha, Vrishanam cha. Stana and Vrishana. Acharya Dallada over the Nibandha Sangraha speaks that there is involvement of the Stana also during the Maithuna Prakriya. And probably horripilation and mechanical changes takes place at that level of the Stana Bhaga. In order to get a girl child, definitely prolactin content, FSH content, they are all required. And from the anterior pituitary, further secretion of different hormones when we look into, minimally these hormones are in the biological range, they should be present. Looking into that particular aspect, probably Sushruta was very clear. Even Stanas got role over the Shukra Srotas, and that may be the part of the Shukra Srotas. Vagbata says that Mushka, the testicles are the scrotum. Stanabhaga and Majjadhatu is also the part of Shukra Utpatti. Because Majjadhatu is the Pura Dhatu. Uttradhatu Shukra, already Sthai and Asthai Dhatu component has been discussed. In Majjadosha Vikara, if there is Majjadushti, Swadutiktakam Veshanam has been told. Madhura Satmaka part will go to Shukra Dhatu and Tiktara Satmaka part will go to the Asti and Majjadhatu. In that way, application of the Rasa Vikalpa, Guna Vikalpa has been very well told in the basics. From that, the applied aspect has to be understood and a patient should be benefited. Now, as I already discussed, Shukra Dhatu leading to Dhairyam. Yes, Shaurya, Dhairya, Chamana, luster. Shaurya, Dhairya, vigor and vitality. No doubt. So, of course, there is no any generic differentiation here. Today, the whole world is looking after that. But we mean to, in the medical science, we mean to again divide between the importance of male sex and the female sex, especially in the infertility problem. Now, Shukra leading to Dhairya. If there is a confusion, anxiety, depression, yes, infertility is definitely a problem. Erectile dysfunction is an end problem. So there is a level of frigidity. Once I visited one of great hospitals in South Karnataka, wherein many patients of sexual problems were admitted. As a counselor, along with my teacher, out of my curiosity, I had been there. One particular girl who was known to me there, she was telling me, see my doctor, you were my family doctor earlier. Very confidential matter I am telling. Lots of frigidity is there nowadays. There is a tendency of avoiding sex. Why husband comes? No, you should not come from the office. Let him be there, sleep at office only. Dhairyam, that happens to a male individual also. He loses the confidence. Because of the lack of confidence, faith on him. If the faith or the trust on him himself is lost, dhairya is lost. if the Shukra Dhatu is proper, that means Rupadravya as well as Yata Payasi Sarpischa Gudascha Ikshau Rasau Tata Tata Nurnam Bhavati Shukraha. How from the Kshira, from there the Dadi, the Namanita and Drita formation is happening. Similarly, from the Ikshukanda, how the Swarasa is extracted out. In the human body, it is secreted during copulation. Thairya is very much required. Chamanam, definitely the adolescent characters and from childhoodness, how the pivotal age, adulthoodness, various characteristic phenomenon changes in the body happening. Chamanam is the attraction, lustre, etc. depending on that age. Pritihi, no doubt, love and affection should be there. Deha bala should be there. Harshatva, ultimately the enjoyment. Upasthindriya karma is ananda, and for bijartha, for the reproduction that has been spoken and that is there in the body. Shukradhara Kala. Ayurveda speaks about Shukradhara Kala, and it is Sarva Sharira Vyapi. Probably all these hormones that are all contributory for the production of spermatozoa, as well as those which are contributory for the pregnancy, as well those which are influential for a human being. Shukra Dhara Kala. Shukra Maha Dhamani has been also told. Now regarding Dhamani, Sira, Pantana, Srotamsi, they are all synonyms. Shukra Maha Dhamanis are in two pairs. From one, the Shukra Pradurbhava is happening, and from one, the Shukra Visarga is happening. Shukra Pradurbhava, nothing but the tunica, vaginalis and connected pampiriform plexus that give the nutrition to the testicular region. From there, Shukra Dhatu, its nutrition happens. And ejaculation, seminiferous ductus or the ductus deferens. That's why Shukra Pradurbhava and Shukra Visarga, Shukra Maha Dhamani has been told. When it is Shukra Maha Sira, definitely the vascularity should be spoken. Vascularity, natural vascularity should be there over the cavernous sinus. A patient had come to me. See, doctor, there was an injury over the penile organ, and there was a growth. I mean to say, he was addressing an hematoma. From that day, I am not getting the erection properly because the cavernous sinus was ruptured. There was a leakage of blood during copulation, during erection. High blood supply will be there. High vascularity will be there. So Shukra, Sira, Dhamani are told as one in Ayurveda, and they are the synonyms. Shukra Maha Nadi. Now Nadi, Pantana, once again, it may be a nerve also, like the pudendal nerve and the sacral plexus. Along with that, it is the seminiferous ductus, the vas deferens, etc. So regarding the Shukra Srotas, Shukradhara Kala, basic anatomy, and the Shukra Nadi, etc., Ayurveda gives a detailed reference. Their understanding is very, very important. What happens in Vitama Parmabhighata? As discussed in neuropathies, nowadays patients of alcoholic comes. Alcoholism induced neuropathy. Main problem. In the beginning, because of the very low dosage of alcohol, by the Ayukti Puraka and Yukti Puraka Madhya. By the Yukti Puraka Madhya, he will be attaining the Pratham Madhavastha, and he will be getting all the benefits. When it is beyond the limit, when he becomes an addictive, so that by the end, he gets the problem like erectile dysfunction and sleepless nights will be there. A person, for the sleep, go on getting consumption of the alcohol, go on enjoying the Madhya, and Madhya Kalpana causing the toxicity, neurodegeneration, as well as alcoholic neuropathy, and end problem is alcoholic neuropathy, diabetic neuropathy, etc., degenerative problems, where there will be severe hopelessness, lack of confidence. Shukra Sara Purusha has been very well discussed in Shastra, and of course the Sara, Prakriti, is very important in the clinical medicine. He looks very beautiful, very attractive, snigdam, his skin is greasy. Sammatam, all body components are normal, very attractive, handsome person. Shveta, Goduma Varna, Asti Danta, Naka, they're all very beautiful and up to the mark, Pramana Sharira, Bahula Kama Prajam, and always interested in sex, of course, as per the direction of the law, as per the direction of the Shastra, he may be involved in all these activities. So Shukrasara, Purusha, probably all these discussions are not made in the Western system of medicine. Ayurveda has got a very beautiful fundamental concept over this. How the ejaculation takes place? Again, there are different theories postulated. Sankalpam, there should be a desire. As discussed earlier, by the weekend couple comes, see doctor, this is our problem, we separate in the midnight, and when we get up in the morning, both are having the mood swings. When the Monday comes, again we are engaged in our activity or official matters, very much busy in our profession. Please help us. Sankalpa, desire should be there. Desire between the both couples, both partners, male and female. Chesta, of course, activity. In the Anangaranga, in the Keli Kutuhala, there is a what discussion. Just like Dhyana, how in Dhyana one reaches beyond its extent. Similarly, sex is a natural activity wherein all the Jnanendriya, all the Panchakarmendriya, and even Ubhayatmaka Manas is involved. Chesta. So activity, foreplay. I had a great master in this regard. And of course, the area of counseling, interpretation in Ayurveda, of course, I was a teacher, I being an academician, I was discussing various these issues of our Shastra, Sankalpa Chesta, Pidanath, so Nishpidana, again, Mardana of the different bodily parts. As well, because of that, the body temperature, the metabolic rate is increased, and the nature has got its own direction as per the synchronizing area of the nature. Everybody reacts and behaves. Sankalpa Chesta, Nishpidana, and Shukra Srava. There is a very beautiful area addressed in Shastra, Atmavega Shukram Pravartati. Atmavega, Manovega. According to his desire and control, one can ejaculate. Definitely. But if there is a Manasika Viparya, if there are conditions like Atatva Vinivesha, Mano Avasada, anxiety, neurosis, generalized anxiety, problems, disorders, depression, then what happens to the Shukra Srava? It will not be in one's control. He may get a total anejaculatory copulation, totally he will be having the erectile dysfunction, ED, or he may get a premature ejaculation also. Regarding this Shukra Sravana, when we look into the websites, we get one information. In the South Asia, in the young adults, one particular problem is addressed with Dhat syndrome. Dhat syndrome. Probably our Samskrita Dhatu has been converted as a coin term, Dhat. Dhat syndrome. Dhatu is going out. Shukra Dhatu is going out during night hours, nocturnal emission. And there is always discharge of the Shukra Dhatu. A male partner will be telling, or a young college student will be telling. Then we have to patiently listen to him. Yes, there is some involvement of the manas, anxiety, neurosis, anxiety, over anxiety, and you have to do the Santwana, Harshanadi Upakrama. Tat Stri Purusha Sanyoge, Cheta Sankalpa Pidanat, Shukram Chevate, Prachavate, Snanat, Jalam, Ardravat Patadiva. When we squeeze an Ardravastra, wet cloth, how the water is getting ejected in the same fashion during the copulation, Shukra Dhatu, its Nisarga takes place. Vata Dushti in the ejaculation. Now, ejaculation, its mechanism very important in the infertility. Of course, by the aspiration also now fertility takes place. There are methods of in vivo and the in vivo the infusions. Also IVF as well as IUI, they are been evolving. Further, Vata controls the manas. If the manas is under control, if the buddhi is under control, if the dhriti and smriti, of course, one has to remember, one has to think about sankalpa. So mana, dhriti dhriti and smriti, these faculties of vayu, and these faculties are controlled by pranavayu, udanavayu, etc. Prana and udana, there comes the desire. When the sexual desire comes, yes, copulation happens. And already Shukradhatu is known for Preeti and Chavana. Lot of affection should be there, understanding will be there. Nowadays, lots of cases are pending in the courts. If you look into or talk to a judge, what are the highest, large number of cases? Marital conflicts. And during lockdown in the newspaper and media you are reading, yes, there are various cases are happening, marital conflicts. And reports are coming, FIR is happening. Yes, mana, buddhi, dhriti, smriti, etc. bhavas. They are controlled by vayu and they are very much important for copulation, for desire. Now, mental disturbances. Why? By the abhava karma siddhanta. I believe there is a particular theory called abhava karma siddhanta. What is that abhava karma siddhanta? If a particular person is absent, he's died, we will be remembering, yes, he should have been there, and if he is there, of course, wonderful things must be happening. In his abhava, we are remembering. Now, when the prakrita karma is not happening, when the normal physiology is not happening, when the mind is disturbed, cognitive impairment is there, sexual act doesn't happen. Sexual impairment will be there. And what will happen? There will be a conflict between the couples. So that this is controlled by vayu, ejaculation is controlled by vayu. Vyanamata, it is sarva sharira vyapi. As well, it will do the dharana karma, the shramana karma along with apanavayu, ejaculation and holding. Holding for a particular time, discharge at a particular time, controlled in a synchronized manner with apana and vyana. Now, the vitiated vayu will do the upashoshan of the Shukradhatu. As discussed earlier, Shukradhatu becomes Tanu, Ruksha, Vivarna. Shukra is Snigdha, how it is going to become Ruksha? Means the normal Snigdhata comes down. In that way, Vata affects the psychosexual parameters. Psychosexual parameters, so desire, orgasm, etc. are hampered. Thus, Pranavayu and Udanavayu role is very, very important in the manifestation, in the what you call the control of ejaculation. Further, we get different mental issues, mental problems, psychological problems. So, if a particular patient is on narcotics, if he is on hypnotics or some antidepressants, the ultimate end problem is infertility and Dvajabhanga like issues. Then both couple will come, see doctor. Now we have lost our hopes in the life. This is one of the areas we have to do the counseling. Probably our Vajikarana Shastra is an Ashtanga, amongst Ashtanga Ayurveda, addresses various these components. Pranavayu, Udanavayu, Vyanavayu, Apanavayu. Prana and Udana, higher mental faculties, followed by thinking, sankalpa, etc. Vyanavayu, as discussed earlier, Sarva Sharira Vyapi, doing the dharana and pravartana. Apanavayu, definitely a sthanik vayu, and samana do have a role in the production of Shukradhatu, that is the metabolic areas. That is why once if the manas is under control, the buddhi is under control, nischayatmaka yatu buddhi. Saumanasyam garbhajanakana, Tarak already discussed it. So Vata dosha has got a wonderful control over the sexual components, etc. Of course, Shukradhatu, as per as per its normalcy, as per the stimulation, it is getting ejaculated. Retrograde ejaculation is a great area. And in the Shastra, when we go through in Sharangadhara Samhita, Shukra Pravartaka, Shukra Janaka Dravya by Chakrapani, Shukra Sruti Vruddhikara, Shukra Rechaka by Sharangadhara. What is this Rechaka Dravya? I had a patient. An young old lady brought some one couple, young adults, both married very recently. It was not, of course, a child marriage. Her grandson only got married, a young child, means after the age of 20 plus. Then her problem, this old lady was telling, my grandson is not performing well. I didn't understand. He is not performing well? What are you telling? No, doctor, see, I brought both of these people, husband and wife. Now you can understand. Yes, correct. Grandma was very right. What are the problem? I spoken to him very confidentially. He told, I am getting a satisfactory reaction. And I also discuss this with the Vajikarana Mitra Mandali. Ayurveda, there is a group of people, and this Vajikarana Shastra, sexuality activity need to be discussed amongst people of common age. Good, wonderful. I discussed it with some of my friends. But the problem is, by the end, no ejaculation is happening. Then I remembered Sharangadhara's contribution, Shukra Rechana Prakarana. Shukra Rechana etu Brahati Falaha. Brahati Fala Kshirapaka. What we did is, we did the prayer of the Brahati Fala Kshirapaka. Brahati Kantakara. Of course, this Brahati Fala, cooked well and transformed into Kshirapaka, and Shankara was added, little amount of Grita as Pakshepaka, and given to this particular boy. And he came for 1 or 2 follow-ups. After that, he disappeared. After several months, again, the grandma came along with both of these. Why you again appeared? Is there any problem, and what happened? You didn't give the feedback. He told, my grandson did a magic. My grandson did a miracle. She's carrying. Your Kshira Kashayam has been helping. But that means to say, Brahati being a Matahara Dravya, one amongst the Dashamulas, one amongst the Mahat and Lagu Panchamulas, is a contributory medicine. Probably Acharya Sharangadhara observed this. Regarding the viscosity component, there comes a prayer of Shalmali prayer. Shalmali. Now, Shalmali Grita is a most beautiful remedy told in the Vajikarana Prakarana Vrishadikara Vaishidratna. I was just going through why Acharya described Shalmali Grita in Vajikarana. Everybody speaks that Shalmali is very good for ulcerative colitis, in Rakta Pravahika, in Raktaja Vrana, as well as in Raktaja, what is ulcerative colitis and so on, bleeding for rectum, and wound healing. Fine, it is Vranaropaka. But this particular Shalmani is Madhura Tikta. It is known for its Snigdha Guna, Picchala Guna. By the Vata Dosha influence, Tanutva, Rukshatva parameters are disturbed. The immediate watering is happening. Then if Shalmali Grita is given, there is a miracle again. Within a few days, patient comes with a smile. This, both of we are getting our goal. So, this sexuality is a very, very important phenomena between the couples. We have to address those parameters, and sexuality and sexual counseling, sexual behavior, because nowadays, of course, the generic difference. We need to address a female partner also regarding all these areas. Probably some questionnaire should be developed and feedback should be taken. Then she will be in a position to say, yes, doctor, you are right. Before 30 years, when we started our practice, female population, they were not revealing any history. Now they are in a position to tell, yes, this is the problem we are facing. So that will help in the pregnancy, and the infertility index is getting swallowed as well. Various components, the influence of vata dosha, influence of different factors in the infertility and erection should be addressed. Male reproductive organs, as per the reproductive medicine, basically the testicles, and testicles are in the scrotal sac. We'll get cases of undecided testes and microarchaea. It was again a story. A young couple came on a particular event. See, doctor, last 4 years we are married. No any pregnancy. When the patient male partner was thoroughly examined, in the scrotal sac, no testicles only. By the age of 28, by the age of 30, an adult man with engineering qualification doesn't understand there should be presence of testes in the scrotal sac. Our people are so much ignorant and unaware of the situation. And it happened reverse in another patient. Both couple came after a few days of marriage. And the wife was addressing me, see doctor, I'm telling a piteous situation. My husband doesn't have any testicles, scrotal sac is nil. I immediately appreciated her feelings. Yes, you are a wonderful lady. Now you will lead a successful life. By the ultrasonography, it can be identified. But if this undescended test is identified at the early age, we can help. Of course, one of these two patients, he had very minimal spermatozoa. That is, oligospermia was progressive, and by the Panchakarma Chikitsa, of course, after a few years of exercise, one issue they are having. So testis in exocrine and endocrine, that secretes testosterone by the help of growth hormone, etc. Epididymis. Now, epididymoarthritis are the problems in sexually transmitted diseases. Again, 3 decades before, we have been seeing multiple number of arthritis patients. After that, the big brother came into the medical field, HIV and AIDS, and it was missing. And nowadays, the HIV AIDS also went. Our COVID came. We had to see what is going to happen over the reproductive medicine by the COVID. So epididymis, Shukradhara Kala, semen vesicle, prostate gland. Of course, the prostate secretion adds for the pramana of the Shukradhatu. Prostatic control, it is required for the lubrication. And in prostatomegaly, of course, the erectile dysfunction is one. Prostatomegaly usually happens after the 5 decades. In the retirement age, we generally call, if any prostate patient comes, are you retired? How you came to know, doctor? Yes, every man gets all these issues by the 5th or 6th decade. One single question is enough for the diagnosis. Then, yes, doctor, by a single point, your diagnosis is over. And I underwent so many investigations. So this prostatic gland has got secretion, and this fluid will add to the Shukradhatu, it is Drava Pramana, Drava Dhatu. Bulbourethral gland, again, it is required, when which Dhumayati Vacha, if there is bulbar urethritis, and if there is glandular swelling, patient will feel burning sensation. Other organs like vas deferens, ductus deferens, ejaculatory duct, Shukramha scotus, its vichedana, or in the vasectomy, this is a very great problem. And recolonization like issues comes. Urethra, of course, wherein the mucous membrane is highly sensitive. When the Shukradhatu, its ejaculation takes place, the maximum height of orgasm comes. Penile organ, through which urine as well as Shukradhatu, seminal fluid, both are getting secreted, and ultimately the prostate gland, once again, it has got a wonderful role in the semen, the discharge or ejaculation. Now, semen. So this is an ejaculatory fluid containing sperms, accessory organs, bulbourethral glands, and of course, now different methods, the semen can be collected, sperm can be collected, so there are aspirations, techniques, etc., etc. So the medicine has developed to that extent till to get the orgasm. Shakram, Dhairyam, Preetim, Chavanam. If all those goals to be reached, so the semen should be intact. It should have its own normalcy. Its specific gravity is 1.028, pH value is a little alkaline, and around 2 to 6 ml per ejaculum it is getting discharged. Regarding its volume, already we had a vast discussion, and Ayurvedic herbs, Ayurvedic preparations, our Avaleha Grita Kalpanas, Taila Kalpanas, our Shirabasti Kalpanas, our Yapanabasti, and Mamsarasa Siddha, Rajayapanabastis are wonderful to target various these problems. As well, when a patient comes with a reaction problem, in recurrent infections, reaction of the semen, in recurrent urethritis, recurrent orchitis, character, pH value is going to get changed. So we have Shodhana Chikitsa. And Acharya Charaka explains Shukra Shodhana Mahakashaya. Shukra Shodhana Kashaya should be given to patient. As well, before any prayog of the Vajikara Dravya, we need to advise Tatra Pura Samshodhana Meva Karyam Sattvanuyukta. Pura Samshodhana Meva Karyam. Do the Samshodhana Karma. Give Kotta Shuddhi. After the Kotta Shodhana is achieved, do the prayog of Vajikara Dravya. Why means we have to prepare our gastrointestinal tract, we have to prepare our digestive system and metabolic system in such a way that there should be a highest absorption. Regarding that, when we speak about Shunti, now Shunti is Deepanapatana, everybody speaks. Shunti is also Triptikana, that's also alright. But Shunti is Vrishya, how it is? If we enlist and calculate in all Vajikara Dravyas, how many times Shunti is repeated? In n number of yogas, in ample of yogas, Shunti is Dravya. Why? If the Shunti is added, absorption rate is multifolded. Directly Shukradhana is stimulated, that's my opinion. And Sarva Sharira Vyapi Shukradhatu is stimulated. Being it is Ushna, and it is acting on the Pitta dosha also. So that 10% of the sperms, 90% of the plasma, total count is average, may go up to 150 millions also. Is its survival time almost after the ejaculation in the laboratory, nowadays up to 48 hours, and the semen banks have come into force and existence. Its motility rate 3 mm per minute is on an average is understood. Composition. In a fluid, 10% are spermatic bodies, and other productions of the seminal vesicles, they are about 60%. Other products from the prostate gland, about 30%. In total, 100% comes. In that way, the composition to a person comes with these issues. See, doctor, the ejaculum, the fluid is very less. Prostata magale. Now our Shilajit is a master drug for any prostatopathies, prostatic gland hypertrophy, Shilajatu Gugulu. Rasayanam Cheyam Yat Jaravyadinashakam Yatamrita Rudanti Gugula Sharitaki. Gugulu and Shilajitu. What is the beautiful combination? Chandra Prabhavati, Shiva Gutika. So in prostatopathies, the hypertrophy of the prostatic gland, hyperplasia, definitely Shilajitu, and Shilajitu is having a great role for the D-isotestosterone, DHT. So over this particular hormone, the derivative, it is acting. And Gukkulu reduces the size of the gland. Because of that, at a particular age, by the 5th or 6th decade also, a person may have the sexual behavior, sexual activity improve. So with this scenario, a semen fluid should be very, very carefully examined by a clinician. Our Ayurveda Shastra supports all these factors, probably at length. And our Acharyas understood all these components thousands years before. So for a quality fertility, what are the requirements? Minimum of 2 ml of the fluid, about 20 million of the count is desirable. 70%, 25% average should be alive. 50% should be having the motility, good motility. 30% should be of normal morphology. As well, the head defect should not be there. It may be below 35. Tail defect should not be there. If it is there, it may be below 20%. This is an average statistics. However, when we attend a problem with the referred to biology and applied area, we have to study the case at length, and all these psychological parameters, when we mix together, our patient will be very happy by the end of the year because the fertility index will improve. Now, spermatogenesis, of course, there are 4 stages. Stage of proliferation. So there comes Shukradhatu Utpadana, means probably from Vajradhatu, Uttradhatu we speak. Ayurveda says it's stage of proliferation by the influence of the hormones. Stage of growth hormone is very much required. Stage of maturity should be the area. Stage of transformation, yes, gradually it is growing and achieving the mature size, tail, body and head, mitochondria, the chromosomes, genetic codes, so stage of transformation. So from that particular aspect, spermatogenesis, its theory should be understood. There are, as discussed, role of hormones. That's why yatha paisi sarpischa gudascha iksho ratho sata nirnam bhavati sarva sharira vyapi shukradhat, which is adrishya, invisible. Then the hormones should be addressed here, testosterone component. Yesterday only I had a patient, hypotestosterone, hypogonadism, hopelessness. No. Yes. Can we treat? There are certain guidelines. If that is treated properly, he may get some hopes. Follicular stimulating hormone, of course, that is required because matrijan pittaja bhagas. A man will have a female child. Though she's a female, she will be getting a male child. These hormones are very important. Luteinizing hormone, estrogen component, and growth hormone. These 5 hormones are very important in the growth of a sperm, and there are different stages discussed, like the stage of proliferation by the growth hormone and testosterone content, stage of growth by the testosterone content and growth hormone will be definitely influenceable, stage of maturation by testosterone, and stage of transformation by testosterone, FSH and estrogen. Whether Ayurveda treatment can address these problems, our students ask. Yes, we can address many of these issues. Of course, Ayurveda says sadhya prakarana, sadhya katasadhya, asadhya and pratyakya, rupakrama vidhana should be totally understood by a chikitsaka. Then only atrasya antaratmanam navishati tattvavid, he should understand in depth, go to the mind of the patient and satisfy him. Maybe some of the hormone issues can be addressed well, like the prayoga, the vastanda, the yoga has come a very beautiful remedy in many issues. As well, prayoga of ashwagandha. Why? Because when I was about 10 years before, I was just prescribing ashwagandha oleha to a boy around 15 years. Good. The family was from Kerala. See, there is a natural curiosity and a basic knowledge of Ayurveda amongst the Kerala population. After a few days, again the parent came. My son has been prescribed ashwagandha oleha. Whether he will get some problems in future, his question was very interesting. I told, I intentionally wrote ashwagandha oleha. Why? Because his voice was a feminine voice he had. Looking into his feminine voice, I thought he should be given some, stimulate some pitta jabavas. When he reaches another 1 or 2 years, you can see him, he'll be having beautiful hairs, etc. You just do the follow. And after that, when you function after a few months, he told, my son is doing very well. So ashwagandha has done wonders. Now the same ashwagandha, due to a natural HCQ parallel drug, it has become recommended for the prevention of COVID also. See, ashwagandha should be, it is ashwagandha only. Ashwapat Vajikara. So this Vajikara Dravya, Parama Deshaja, Indian ginseng, it's Kshirapaka Vidana, Grita Vidana, and Avaleha Vidana. So many kalpanas are told in the Shastra. So at the level of the hormone deficiency, hormone imbalance, we may have to think about the prayoga of these different kalpanas and chikitsa kramas. In that way, the graphical representation shows that the hypothalamus, hypothalamo-pituitary activity is stimulation. From there, the interstitial cells are stimulated. From there, there is a negative feedback and testosterone production will be there. And from the anterior pituitary, again the seminiferous tubules are stimulated. Sperm production will be there beautifully. So that the role of pranavayu, role of udanavayu, role of samanavayu, apana and vyana. Though for samanavayu, at this particular, the role has been not discussed. Metabolic and digestive phenomenon that should be thought of when we come to the therapeutics. So from the cerebral cortex, hypothalamus is getting stimulated, secreting the releasing hormones. From there, the anterior pituitary will be releasing FSH and LH. After that, the testicles are stimulated, will be secreting the testosterone content. From there, there is a sperm production simultaneously. There is an inhibition mechanism. So in that way, the negative feedback mechanism along with the hormone control synchronized manner, wherein the energy, pitta dosha, the energy, vayu, due to its chala samarthya, and prana, udana, ultimately apana, in between vyana, comes here. Metabolic and hormonal changes, definitely that is sama. So all the pancha vayus, I told, pancha jnanendriya, pancha karmendriya, ubhayatmaka manas, just like dhyana and yoga, in the sexual activity has been addressed by Anangaranga and Keli Kutuhala. There are some 7 defects. They are commonly seen in the practice. Such problems like azoospermia, no sperms are seen. Patient will ask, can Ayurveda do something? Of course, there are some reversible areas also. I can't say every problem is reversible. There are irreversible problems too. Oligospermia, wherein the count is getting less, below 20 million. Oligoazoospermia, teratospermia, wherein abnormal morphology will be noticed. Astenospermia, sperms with lesser motility. Aspermia, no ejaculation, and retrograde ejaculation may happen, etc. Anejaculatory copulation may be there. Hematospermia, shonitam eva, tudotyartam. Leukocytospermia, puti puyanibam, kunapagandicha, necrospermia. All these problems with the various clinical findings, they attend the infertility clinic. Now, Vajikarana Shastra, the Vrisha Chikitsa, has got a vast scope today. As discussed earlier, it is just evolving in other countries. We got this concept and thought several years and centuries behind. So, Vajikarana and its scope. Yena narishu samarthyam vajival labate naraha vijaychabhyadikam yena Vajikarana mevatat. Charaka further says, Vajikarana Shastra is very much essential for the apatya santana. It is sadhya samprakarshak also stimulant. Vajivati baloyena dhairya chamana priti yatya prahityata striya. Why Vajivati bala? when we differentiate a male horse and female horse, height of the female horse at that particular age is higher than a male horse. That is why male horse need to have that energy. Vajikarana. That is one area. Putra kameshtiyaga, again vaji. Vajavat, avaji, vaji. Vaja shukram, avaji, vaji kurte. That is also correct. So, bhavat yati prihas trinam, ena upachiyate, tat vajikaranam taddi, dehasya murchas karampara. If once bigger vitality, testosterone component, shukra dhatu, and dihydrotestosterone is his component is all right, he is fit. There are certain dravyas. They are shukra janaka. Shukra janaka in the sense spermatogenesis, maturation. Shukra pravartaka, they may add for the pravartana or motility and ejaculation. Shukra shodaka, dosha dushita shukram shodayati. Shukra rejaka, like brahati phala. Shukra stambaka, definitely in premature ejaculation, PME like condition. Shukra shoshaka, whether Vajikarana Shastra says regarding Shukra shoshaka dravya, I say no, but answer is also yes. Why means, in the future slides, I can clear these areas like Shukra shoshaka also. Vrishya is basically Madhura because Samana, Vriddhi Samanehi, Dravya Samanya. It is Stigdha because Shukra is also Stigdha. It is Jivaniya, just like Kshira. It is Brahmana, I say Brahmane Shakti is a Guru. It is Guru already. Harshanam Manasastaiva. After the intake is made, one will enjoy. Manasastaiva, all Manasika Lakshana will go out. Tad Sarvam Vrishyamuchati. And Vajikarana, Pura Karma is also said, like Kosha Shuddhi. And Acharya Janaka says in the Rasayana Adhikara, Harita Kainam Churna Nisainda Vamanaki Gudam, Vachavidanga, Pippali Rajani Vishwabeshita. Tridina, Saptadina, Panchadina Paryanta, if this is given, there will be a Kosha Shuddhi and go for Rasayana Vajikarana Prayoga. Or otherwise, a classical Vamana Virechana, Sadhya Virechana, Sadhya Vamana, etc. carried according to the need. Once if you do the Shodhana Karma, Tasmat Pura Samchodhana Vyavakarim Balan Rupam Nahi Vrishya Yoga Siddhyanti Dehe Maline Prayukta Tishteyata Vasasi Raga Yoga. So, this attempt, a cleaned cloth, how on olden days our ancient Indian population were making this. Similarly, when our gut is clean, GI tract is very much clean, Vamana Virechana, etc., karmas are performed, then the absorption rate will multifold, just like the Prayoga of Shunti we have discussed. There are Shukra Pravartaka Dhavyas. Kadali, Yata Brahmande, Yata Prandande, and moreover it is Madhura, Shukra Samana. Badam, it is containing an oil seed. Kusali, Yasmat Dravyasya Shukrasya Vriddhi Syat, Shukralam Chataduchate, Yatas Shuganda, Mushali. Amalaki, a wonderful Rasayana, Dhatri, Vaistapaka, Grita, Kshira Taila. Of course, all these Grita Kshira Taila yogas are repeatedly told. Parando is in Uttajaka, Ballataka in Kavadushita Shukra, Ashwagandha is again to reach the orgasm, and Sharkara, fructose component, the pH value if altered, then Kandasita Kalpanas, Masendika Kalpanas. Shukra Stambana, Jati Phala and Jai Phala, Jati Kosh, Akar Karava, anacycles, Pyrethnam. So if there is a PME, erectile dysfunction, all these yogas, Lodra, also Shukrameha Prakarana. So Shukrameha, Shukravritavata, conditions like Mutra Shukra, they're all discussed in our Shastra. Shati, again, Darugandhinashaka, Sugandha Varga Dravyas, by the time of Chandragupta, by the time of Chanakya, sex medicine became very, very popular. And Navaratnas were there in the Asthana. They popularized this concept. Probably all these Pancha Sugandhi Dravyas came into the first and practice of Vajikarana by that time, Nagakeshwara, Chandana, etc. Mocharasa, if there is a viscosity component is attending. Ahifena, a stimulant, but of course today there is a great problem, great ethical issue, legal issue in taking Hivena Kalpas, Bhanga. Pug and Tatura, wonderful, they are stimulants. So, Stambhaka Dravyas, if a patient comes with erectile dysfunction, premature ejaculation, nocturnal emission, Dhat syndrome, these series of drugs, they are going to contribute and help. Shukra Rechaka Dravyas, of course, to have a satisfactory ejaculation, Brahati Phala already discussed. So the young couple, young adult, recently married, came with this finding by the grandmother, Kantakari, Kadali, Shitavari, Kokshira, Kokilaksha Bija, this Talimkana, Kokilaksha, Ikshuraka, Estimadu. Why Estimadu? Estimadu has been vastly studied in the Western countries as a very good remedy for neuroregeneration. Concept of neurodegeneration, damage of the nerve cells, axonal dystrophy, dendrital dystrophies, posterior horn cell damage, so Estimu in neuropathy. Madhyasti Thailam, we have wonderful Madhyasti Thailam in Shastra, in the Vaswanita Prakarana, Kanda Sharkara, Bala, Vidharikanda, and Punarnama. So these are the Shukra Rechaka Dravyas. Shukra Vardhaka Dravyas. One by one, the Chikisa Prakarana at length will talk it. Bala, it is Balya, Bala, Musali, Shatavari. So Dhaturupi Shukra and its Pramana is increased to Masha. So Masha is Snigdha, Madhura, and Avishandi. The Pikachu, a stimulant, a wonderful Pikachu. Clinician and infertility specialist in Mumbai was telling to me, you get a wonderful herb. What that herb is doing, a seed, wonders. He was taking the name of Kapikachu, Shweta Palandu, Amalaki, Kandasita, and Estimu. So these are the Shukra Vardhaka Dravyas, Shukrala and Shukra Rechaka Dravyas. Their series has been told. Shukra Balya Dravyas. Shukra Balya Dravyas, in the sense, these are all the later categorization after research study in different centers like Gujarat Ayurveda University, in Government Ayurveda College, Thiruvananthapuram, Puram, and different universities. In Rajiv Gandhi Health University, maybe in future coming days, the MGR University may also take all these research areas. Bala, Atibala, Stavri, Ashwagandha, Gokshura, Kapikacha, Masha, and Estimadu are the Balya Dravyas, Shukradatu, and energizers. One will get happiness as per the volume is concerned, as per the energy, etc. Now, regarding the Shukra Hrasaka, Shukra Shoshaka Dravyas, Shukra Uttejaka Dravyas. Shukra Uttejana. How Shukra Dhatu formation and stimulation like Tambula Patra, Mukadaurgandhanachaka. Yes, once a couple came to me. See, there is a lot of misunderstanding with us. Then this male partner was telling bad oral hygiene is the problem. Can you suggest? Our Acharyas had a great concept of Tambula Sevana, Nagavalli Sevana. So, this Tambula, Lavanga Prayoga, Ela Prayoga probably came into practice. Shukra, Hrasaka and Nashaka Dravyas, Karavellaka, Krimigna, Nimba, Krimigna, Tulasi. Now Tulasi is a great drug. But once from Mangalore, one patient came around the age of 50. He told the doctor, now I want to get married. What is your age? 50. Who says a person of 50 cannot get married? Yes, he can marry. What is the problem with you? I had 7 sisters. All my 7 sisters know what I did after my father's departure. I took a challenge. One by one, all of them are getting engaged, they are married, they are happy. Now all 7 came to me, they are telling you have to get married. I thought marriage is a dream for me. I thought that's why I had been to a Swamiji and took some dravya. Now I am impotent. Can you treat me? I told what you did. I see sannyasi. They do the Tulasi Mala Dharana, Tulasi Japa. Tulasi is Krimigna, Shukra is Krimi-like, and I thought, probably it's a psychology also. Okay. Who is that Swamiji? He gave the address. Both of went out of our curiosity to the same Swamiji. And he was a master of Ayurveda science along with Jyotish Shastra, Sanskrit, etc. And he told, I gave, of course, Tulsi Mani and Shukra, the Tulsi Mula. Now there is a remedy in Tulsi only, Tulsi Bija prayer. If you do the Tulsi Bija, you'll get the problem addressed. Later on, he got married, had a child, very late. Fine. Maybe with the part of Tattva also, when the same Swamiji suggested, all this happened. Similar way, the prayer of Tankana and Kshara Dravyas also are the problem. Like that, we get the reference of the Sri Gopala Taila in erectile dysfunction. By the application of the Sri Gopala Taila, there is blood flow is improved. The penile vascularity is improved. There is a sort of stimulation and maintenance of erection. In that way, our patients are with a smiling face. After a few days, they come, doctor, your treatment is helpful. Your treatment is helpful. Now, what is infertility? It is the failure to conceive after 1 year of the regular sexual attempt. Sterility and infertility, they are always mixed and confused. No need of confusion. Now, infertility is the recent term and sterility is the earlier term. In the old text of medicine and after it is gynecology, surgery, all those things were spoken. And nowadays, better we go to this infertility issue and talk about that. There are certain factors. One is the Rutu, phase of Kapha, ovulation in female. Also, Kapha-dosha, Shukra-dhatu. Kshetra, definitely healthy uterus, healthy genital tract, any other tubal infections should be targeted. As well, no infection should be there. That should facilitate the easy entry of the sperm. Ambu, nutrition elements and hormones of the fluid, nutrition level. Bija, that is the womb and sperm. So, Rutu Kshetra Ambu Bija has been told in the Garbhava Kranti. These are the factors. Disorders of the Rutukala also should be considered. Like in a female, probably already Mahata Madam will be throwing a light on that. Disorders of the amniotic fluid, fine. Disorder of the Bija, especially the Shukra Dhatu, should be addressed here. Defective spermatogenesis. Yes. Defective spermatogenesis in case of mumps, parotitis. If you ask the history to a male partner, had you mumps? He will say no. And a patient had come to me back. Doctor, you asked me a question. I brought my mother also after a week. And I asked the mother, my doctor asked me, because of the infertility problem, had you history of mumps? Then she told it is yes. When I was in high school, I had parotitis. Wonderful. So parotid gland, honeycomb-like appearance, SNR cells. Pancreas, honeycomb-like cells. Testicles, honeycomb-like cells. So there is a common distribution, even ovaries. When there is a viral attack over the parotid gland, there is a chance of getting arthritis. And in Shukra Dhatu Gata Jvara, an irreversible change can happen. Defective spermatogenesis. Obstruction to different duct system. Obstruction in the ductus deferens or the prostate enlargement is causing that duct problem. Retrograde ejaculation may cause that. Failure to deposit sperm into the vagina, maybe premature ejaculation and vaginal tract issues like severe frigidity, painful coitus, etc. Abnormality in the semen fluid. So, abnormal components. Andropause. These aspect is nowadays taught in the Western world. Andropause, just like menopause. So, this old fellow, memory impairment, doctor, say I am unable to have the sexual copulation. I am not reaching my desire. Memory impairment, insomnia, sleepless nights, always anxious and depressed. I lost my hopes in life. Emotional and behavioral changes, getting angry. Why? What are you? And during our course of sexuality and sexual counseling, master training program, of course, there was a rehearsal. These areas are very important. Emotional, behavioral changes. Sex medicine should be developed at that reach. Our young couples should get the benefit, and they should be in a position to talk freely to the clinician. Decreased muscle mass and increased body fat, staulia, loss of libido, and osteoporosis. So these are seen in andropause, and just like menopause, these areas also should be looked into and thought of. Defective spermatogenesis by undescended testes. Already several problems we have been seeing, and testicles are hanging out from the body due to their own maintenance of temperature. Architis picture will resemble there is spark is going on. Klinefelter syndrome, once again a chromosomal defect. And in conditions like Prameha Roga Adhikara, etc., Kushta Roga Adhikara, etc., a Dushita Shukra, Jata Pramehi, Madhumehi Nova, Nasadya Bukta, Sai Bija Dosha, Ye Sadike Chit Kulaja Vikara, Nasadya Bukta, Sai Bija Dosha. Today, hypothyroidism and thyroid issues. Gonadotropin releasing defects, varicocele, primary testicular failures, and some of the drugs, anti-cancerous medicine. Working in a bakery, I had a patient, he was telling, see doctor, after several years of marriage, my problem is this. What are you doing? I am working in a temperature. I am working in a bakery. I was working in a hotel, tandoori rotis were preparing. His Adhonabi Pradesha, his lower extremity, always exposed to temperature, and I believe definitely this temperature killed his spermatogenesis. So Atyushna, exposure of the Atap and Atyushna Dravya. Hot water bath. Usually when we take the hot water bath, Acharya says that Ushnambuna Adakka as a Sukotombuna Uddaret, Parisheka Sukavaha. Lukewarm water is enough, or Shitodaka Parisheka is enough. Once an article appeared in a leading magazine. Indians lose virility, and immediately I opened. I was traveling in a train. Indians lose virility. Yes, he was covering so many issues. In the ancient Indian times, people were taking bath in the pond or in river, tying a langoti and sitting for puja. 8 o'clock morning, their puja will start up to 11 o'clock, 3 hours continuous. This ardra vastra and exposure to cold, as well as the testicle is hanging beneath the, that is out of the body, outside the body. Spermatogenesis is very, very active. And if we ask our grandfathers, forefathers, how many children you had? One cricket team of India. One minus cricket team, 11 children. Why? The fertility index was so much potent, and why we people lose this? Probably our lifestyle has been changing, and a lot of other components like infection, sexually transmitted diseases, tuberculosis, hydrocele, filariasis, mumps, etc. Nowadays a theory has come, antibodies. Autoimmune theory, the antibodies thus generated will kill the spermatozoa, and there will be problems in the spermatogenesis. Ejaculation issues also will be there, like retrograde ejaculation, premature ejaculation, and anejaculation. Anejaculation, yes. I had another patient from State Bank of India. Doctor, see, we are young, problem is we are not happy. Thoroughly the patient was taken history, and lots of times we consumed. After almost 1 or 1.5 months, we came to know there is an anejaculation. In that way, anejaculatory cycle, ejaculation, retrograde ejaculation, and premature ejaculation looked into. Stress is also a great area. Everybody is stressed. A child at the school level is stressed, an elderly man is stressed. Phobia, of course. Tumors, cancer, chemotherapy, etc. Testicles due to the overexposure to the temperature or heat. Already we told a few examples. And the wearing very tight undergarments, laptops. Tomorrow a problem will come. Laptops, testicles are compressed. Repeated exposure to X-rays, history of vasectomy, etc. Alcohol and smoking. Alcohol and smoking also cause these various problems. And nocturnal emission. Now, nocturnal emission in which a patient comes, see doctor, I had some bad dream, and bad dreams usually occur very frequently. I am getting severe lethargy, increased fatigueness, and of late there is erectile dysfunction. Shukradhatu atisravana, Shukradhatu kshaya. Ayurveda believes this particular siddhanta, and gradually the sex medicine is also understanding. Very right, our ancient Indians, ancient Indian culture and literature were very, very strong. Nocturnal emission, etc. So, with these all different findings, the basics and essentials of understanding Vajikarana Shastra, understanding of the Shukradhatu, various applied areas. When we start about the basics, we need to address the applied only. Because now the medical world and its teaching methodology has been totally changed. If we start telling only basics at the first year level, nobody is happy. We have to go to the preclinical to the clinical issue. Then only real problem is addressed. So with these different findings, in the next presentations, let us address various pharmacological preparations, kalpanas like Vasti Yogas, and how Virechana should be carried out, how with the different case studies, let us express our views. And if there is any queries, I am very much thankful to DIKSHA, this event management, Dr. Sudhir, our alumni of our institution, and also one of the coordinators in the NABH, because we feel very much happy that our person is there in NAC and NABH. All our Ayurveda institutions are benefited out of him. Now he is the principal head of the institution at Coimbatore, the most prestigious and old institution. Thank you. Thank you.
Thank you so much, sir. We'll take a 5 minutes break, and now the session is open for discussion. I request all the participants to ask their questions in the forms given in the chat box.
Hello. Anggota COVID hospital.
Sir? Excuse me, sir. Sir, can we resume? Sir, Sir, you are on mute, sir. Sir, you're on mute. Sir, can you unmute? Hello, sir.
Now?
Can you? Yes, sir.
Yeah. Okay.
So can we go to the question, sir?
Yeah, you can.
Uh, uh, First question: can Ojakshaya Lakshana be taken as a sign of Shukra Kshaya?
Yeah. ओजक्षीयेत कोपकृध्यान समाधिभिः बिभेति दुर्बलो विष्णो भवेत् क्षामञ्च तत्क्षये has been told by Vagbhata. Definitely, Sarvadhatu Kshayarthasya Balam Vidbalam and the Ojo Shaitilya, Ojo Visramsa, Ojo Vyapat and Ojo Kshaya discussed in various texts of Ayurveda are also seen as a progressive problem of Shukra Dhatu Kshaya, we can speak. Why means, when we go to the treatment, Jeevaniya Kshira Gritabhyaha Tastra Beshajam, we also give the same treatment with these Samane Sarvesham, like Prayag of Krita, Kshira, etc. etc. Thank you.
Thank you, sir. Moving to the next question: how Balataka is act as a rasayana because it is having Katu, Tikta, and Kashaya, which is opposite of Guna of Shukra.
Wonderful. But here, its Vipaka is Madhura, number one. And Ballataka is a stimulant, another area, Uttejaka. Third area, very important area, is that whenever there is Kafadushti, like Granthi Bhutam Kafabhyam, Shleshmabhyam, if there is influence of the Kafa causing increased viscosity for the vilayana of the viscosity component, Ballataka is required. So it is in that way the Shukra dosha is targeted. And in the management of varicose seals, there is an avarodha in the gati of Vayu. And Sira Granthi is happening. For the Sroto Granthi treatment, again, this is required. That way, Ballataka becomes a helpful drug in the Vajikrana Shastra. Yes.
Okay, sir. I hope that doubt was clear. The next question: 27-year-old male with known case of insulin-dependent diabetes mellitus since 14 years, married since 3 years. Patient is very lean and is anxious to conceive his wife. Complains of premature ejaculation. How can we address this case?
Yeah, this is again a wonderful question here. Regarding the premature ejaculation, the treatment is very simple and effective. If the seminogram has been done, we have to think of that. So regarding the PME and his sexual performance, definitely we have to select Akara Karavadi Gutika, number one. Jati Faladivati, like agents. So these Jati Faladivati and Prayog of the Akara Karaba, because of its Grahi Samarthya, Dipanam, Pachanam, Chaiva, Edushnatva, Dravashoshakrit. So immediate stimulation of the cortical system takes place. And these formulations are also found to be very good in the maintenance of the erection for a prolonged duration. Once if there is a maintenance, then naturally the PME comes down. That's what he is requiring and he's in need of that. Once he is able to overcome this situation, then probably the seminogram need to be done. So in that way, prayoga of some Ushna Uttejaka Dravyas, including Ashwagandha, found to be very effective in these problems. Thank you.
Thank you, sir. And the next question, it's actually two questions. How to do the management of Shukra Vriddhi, and what is the role of Agni Mahabhuta and on Shukra Utpatti?
Yes. So number one, the Atistri Kamatam Shukram Vriddham Shukrashmarimapi. If that particular problem is secondary to, definitely secondary to pheochromocytoma or tumors, tumor management has to be done. By means exhibition, etc. problems are addressed in those populations. Whereas, if all the other parameters are normal and excessive sexual desire causing some social problems, social issues, yes, Santwana Harshanas are definitely required. Educative program is required. Treatment wise, when we advise the Shukra Shoshana Dravyas, Shukra Shoshana Dravya like Haritaki for a longer duration, which is also equally very good Vatalamaka, though it is Pathya, it causes Shukra Shoshana after by a larger and longer duration intake. Tulasi like drugs, Caravella like drugs, that will gradually reduce the potency. This is the medical management of the Shukra Vriddhi, I can speak. Whereas, what is the next question? We'll continue with that, Pitta and Agni. So, Agni, Mahabhuta. Though there is an influence of Vata for a maximum extent, Kapha definitely its role, but as far as the endocrinal issues are concerned, the hormonal energy, it is there in Pitta. And this Ushna Guna, because temperature maintenance, the testicles and the scrotal sac is hanging out of the body, means it should have its own temperature. Its own temperature means if that temperature is maintained, the sperm things is intact. So Ushnata at that level is the Pitta and the metabolic aspects. Like if our Agni is normal, then Ahar Shuddho Shatrashuddhi Sadhya Shukrakara Samarthya is attained depending upon the quality of the Ahara. Thank you.
Thank you so much, sir.
Yeah.
And the next question is, what medication can be given if sperm motility is low and concentration is less?
Yes. Janaka Pravartaka Dravya like Kapikachu is the highest drug here. And the prayog of the Masha is also found. Masha as a Ahara, Masha Kalpanas. Of course, Charaka explains Masha Yogas very beautifully. And our Indian society consumes a lot of Masha Kalpanas in their daily food. Simultaneously, Kapikachu induces motility. Kapikachu in the form of Vasti, Atma Gupta or Yapana Vasti, is found to be very, very encourageable, showing results. Atma Gupta, the Yapana Vasti, wherein Kapikachu Kalka is also taken, Kapikachu Kshira Vidana, Atma Gupta Kashaya, etc. And Prayog of the Kapikachu, because Kapikachu is equally an anti-Parkinson's drug too. It has got a stimulating capacity along with or the motility factors acting. Thank you.
Thank you, sir. The next question. What about the people who are sterile? Where does the Shukra form get utilized? And there's another question. The shloka mentioned is with respect to both male and female or just Shukra Bija of male?
Yeah, first question you please repeat.
Yes, sir. What about the people who are sterile? Where does the Shukra form gets utilized?
Sterile, correct. So, Antashukra and Bahishukra is one of the concepts by the later authors. Antapushpa and Bahipushpa is again the later text we get some description and commentary also do speak that. Of course, the Rupadravya Shukra is the seminiferous fluid. In the seminiferous fluid, if the proper spermatozoa is absent, then also they are sterile. But all for their external appearance, they look just like a very, very healthy individual, wherein their testosterone component and their hormonal influence must be all right. Of late, they might have had some problem like the mumps, parotitis, maybe etc. Whereas in a female, Antashukra and the Bahipushpa, that thing, and the explanation of the Shukra Dhatu, that means Matraja and Pitraja Bhava, already discussed. Wherein a female can deliver a male boy means what is that? Definitely Matraja and Pitraja Bhava over together, there is a balance, and that is happening. A parent will be desiring for a female child, that's also happening. So these hormonal theory should be understood, that is Sarva Sharira Vyapi. That should be the Shukra Dhatu, like aldosterone, testosterone, and their derivatives. Thank you.
Thank you, sir. Hope that doubt was cleared. Next question is, how Kamini Vidvarna Rasa and Madanadi Modaka acts on reproductive system?
Yes, this Kamini Vidravana Rasa itself says its name that orgasm. That will reach to the height of the orgasm in both population, male and female couple. Kamini Vidravana is an Uttejaka Dravya, Kamini Dravana Rasa. Therein, female is excited more. Because I was telling you regarding the case of frigidity. So because of the frigidity, she started avoiding sex. Whenever the husband comes, why this fellow comes? That was her problem. When these agents are given, like Anandavati, Kamini Vidravana, Jati Phaladi, that increases energy level, and gradually the psychological changes also happens. Kamini Vidravana. What is the sub-question in that?
The sub-question is, how long can we prescribe these medicines?
Madana Kamereshwari Leham, and so being Kamini Vidravana is a Rasaushadhi, better for a shorter period on the moment. Whereas Madana Kameshwara Avaleha can be given for several months, no problem. It is Rasayana, Balya, Brahmana, and Vajikara both. Thank you.
Thank you, sir. The next question is, why there is no reference for Vajikarana? How should we understand it?
Where?
Sir?
Hello? Yeah.
Should I repeat the question?
Yes.
Okay. So the question is, why there is no reference for Vajikarana and how should we understand it?
Vajikarana Shastra, because our Samhita Granthas, our textbooks, compendiums are written as in the Shloka Rupa, Gadya Rupa, from the Gurukula system, from teacher to the student, it was just mutating. In that way, probably as a separate entity, separate Adhyaya, though it is not there, but Samhita Granthas do explain Vajikarana Adhyaya, Vajikarana Prakarana, Vrishadikara. So in that way, and when some medications are told, like Shukra Vallabha, like the Makaradvaja, definitely in Brahadvata Chintamani Prakarana, if you go in depth, it is said, Vruddhopi Tarunaspardi Kandarpa Samavikramha. So we have to do the interpretation. A Vruddha, a old man at his age, he becomes Tarunaspardi, energetic. Kandarpa Samavikramha, just like Manmata, he will be acting. So from that knowledge, we have to try to explain, because probably our ancient Indian living was like that. Thank you.
Thank you, sir. Next question. The question is, what is the difference between Vrishya and Vajikarana? And what are the pharmacological level, how the Vajikarana and Vrishya drugs differ in their action?
So Vrishya and Vajikarana and Vrishachikitsa and Vajikarana Chikitsa at one level, they are one and the same. But if you go to the root meaning, Vrishya is bullock, Vrishabha. If you see an ox, it is capable of producing a large amount of seminiferous fluid, and it is known for its act and behavior. That way, Acharya might have considered the act and behavior along with the content here. That is Vrishachikitsa. For example, Vrishya Brahmani Kutika and some Kshira Prayogas, Vrishavat, like that. When we go to some Prakarana, like Vajikarana Shastra, wherein already regarding the male and female horse I have spoken. Vajivati balo yena yatyapriyatat sriha. Energy, because in wars, in warfield, in battles, Ashwa is the main animal being used in olden days. Ashwa Shakti, horsepower in the field of engineering. So what that gives the meaning? That animal is known for that. Ashwamedha Yaga, Putrakameshti. It is a model animal even today. It was the model animal yesterday. So it is the model animal tomorrow. That is another aspect. Ashwagandha. So here, Ashwavat means just like a horse, you get the energy, vigor, vitality. And basically, if you look into the nature, female horses having the higher than a male horse. That's why it has to have that much of energy, potency to have this sexual copulation. So that is the meaning here. Ashwagandha or Ashwachikisa, Vajikarana. So this is the Prasachikisa. Pharmacodynamically, in the same way, the bull, it is because in Vajikarana Shastra, several animals, and I remember almost 63 different creatures. Their behavior, their nature of semen, their activity, and sexuality has been taken into consideration. In that way, Acharya explained these particular prakarana, probably, I believe. Thank you.
Thank you, sir. Hope that was clear. The next question is, in your presentation, will you also include lab investigations required for diagnosis of male infertility?
Yeah. Why lab investigations are important means today's patients are very clever and very intelligent and educated. They go to several clinics, several doctors, and by the end they reach an Ayurveda hospital. When all the investigations are there, he only starts speaking, my problem is this, that. So he will come to a lab diagnosis than a clinical diagnosis. And in order to confirm that is required. Apart from that, in the research study, definitely laboratory is required. Our lab values depending upon that, we can prove our drug and we can prove our pharmacological preparation, and for our younger generation, we can give an answer also to the patient equally. Thank you.
Thank you, sir. The next question is how to treat nocturnal emission and management of case of nocturnal emission.
Yeah, nocturnal emission is again in young adults, it is a very great problem. Wherein counseling, Sattvaja Chikitsa, Manaso Jnana Vijnanam Dhairya Smriti Samadhi. So Dhairya we have to bring up. Along with that, some Shukramehagna yogas like Chandanasava, Chandanadivati, Sarivadivati. Apart from that, the prayog of the Jati Kosha Phala. The nutmeg, its outer cover should be crushed well and given along with the kshira or madhu, so that due to its kasha and samarthya, nocturnal emission comes down. Moreover, why counseling is required means guidelines required. He'll be having some bad thoughts, always thinking in an irrelevant way, always looking female in a very doubtful way, in a very eager way. If that is addressed, naturally it will come down. So that is the main area. Some of the ahar dravyas, food items, they are highly stimulant. So ask him to reduce that and go for shakavarka, and that also will give a lot of help in those populations. Thank you.
Thank you, sir. There is another question, which is nocturnal emission does it occur in old patients after heart surgery, as they are asked to abstain from sexual intercourse during this period? Any chances it occurs in old age?
Yeah. So in old age, definitely nocturnal emission is possible. In cardiac patients, sometimes during the sexual copulation itself, there are evidences that MI can occur because the lungs has to get do its exercise in a very, very active way. Cardia has to eject the blood in a very speeder way. So there will be an increased cardiac activity, increased respiratory activity. Due to that, some issues may come out, and some reports are also there. So we have to. But if the patient already underwent surgery, if already is getting his collaterals are done okay, no problem. But drug-induced problems also noticed in the practice. Thank you.
Thank you, sir. The next question is treatment options for alcoholism and drug-induced infertility.
So in alcoholic neuropathy and alcohol-induced infertility, erectile dysfunction, of course, gradually the alcohol has to be tapered down and you have to substitute it Madatya Chikitsa number one. And second thing, if the patient has not reached that degenerative change, definitely reversal is possible. Because I told you regarding the ST Madhu Prayoga. Similarly, in the Khanija Dravya, Swarna is found to be very, very effective. Sarva Rogeshu Vasantaha, Swarna Mali Vasanta, Vasanta Kusumakara, etc. yogas. When gold is given, actually the neuro regeneration happens and there are lots of changes in the body. Along with it, Vojo Shaivat Chikitsa, because this Madatya Roge will get Vojo Visram, Apadan Lakshanas. So we have to give him lots of Kshira, Gritadi, different Kalpanas. Thank you.
Thank you, sir. The next question is, many patients complains erectile dysfunction due to taking hypertension medicines.
So by the anti-hypertensive medicines, of course, pedal edema and infertility along with erectile dysfunction comes, because if they are obese individual, that's common. So here we have to substitute, replace that drug number one, because continuing the same drug will not solve the problem that comes. Along with that, weight reduction is very, very important. He is obese. And we have to encourage diuresis, like Mutra Virechana Dravya, so that his temporary problem can be resolved. Along with that, Vasti, Shira Vasti Vidhana found to be very, very effective. Why means, Apana Vaigunya, Apana Anulomana will occur by that. Thank you.
Thank you, sir. There is a similar question. Can erectile dysfunction be psychological?
Definitely, erectile dysfunction is also due to Manasika Bhavas. Because in the future presentation, all those area comes. That's why we have not expressed here. So it is due to anxiety, depression, etc., and by the phobia that comes. Thank you.
Thank you, sir. Can we treat infertility if they have varicocele?
We can definitely treat infertility if the grade 1 and grade 2 varicocele level comes. We can avoid surgeries also. So definitely some of the Basti Kalpanas, Anvasana and Sneh Basti yogas are showing wonderful changes in these population, no doubt. Along with that, we have to give some Shilajita Kalpas, Bhallata Kalpas for as Shamana Ushadis. Thank you.
Thank you, sir. Next question. A patient with a history of one undescent testis, whether it will affect fertility or testosterone production level?
There is every chance of imbalance in the hormones and his sexual vitality and sexuality, because one in undescent testis, because they need to be synchronized and balanced properly. However, he may have oligospermia or oligozoospermia. We can attend it, but what about the undescent testate which is remaining in the inguinal ring? So that has to be attended properly. So here comes the prayoga of the Eranda and Erandam Prisham Vataharanam, Eranda Kirapaka, etc. So that will give lots of hopes and benefit to this population. Thank you.
Thank you, sir. Hope that doubt was clear. Next question is 31-year-old male, no issues since 5 years of married life. Semen analysis shows 10 to 15 million sperms and motility 50 to 60%. How the case can be treated, sir?
So if the patient is non-diabetic and non-obese, wonderful. If he is obese, then weight reduction, that is Staula Chikitsa, followed by prayoga of Vatavanamana Dravya. So there comes mainly the Eranda Kalpasa only, like the Eranda Sukumaram, etc. should be given for Vatavanamana, because Eranda Sukumaram is such a very beautiful drug in Adhonabi Pravritta Vata. Upon a regulation, along with the production of spermatozoa is also Prisham Vataharana. And it is Mamsa Rasa Siddhavastis. Mamsa Rasa Siddhavasti along with Kshira. Kshira and Mamsa Grita means Yapanavasti Prakarana you have to open, prepare such kalpanas with our own Vikalpa. We may have to add some beautiful Kalkatra like Shatavari, Ashwagandha, Bala, Musta, etc. So Kalkadravya, the Shirapaka, Grita, together with Yamaka, maybe Taila, and Mamsarasa will give additional benefit, and that patient will definitely have an offspring. Thank you.
Thank you, sir. Next question is, in which form Tulasi Bija is administered to correct impotency?
Which one?
In which form Tulasi Bija can be administered to correct impotency?
Yeah, very simple. Tulasi Bija is very pichira. So we have to crush Tulasi in Ushnadak and give it, number one. And Tulasi Kshirapak. So we have to cook Tulasi along with Sharkara and Kshira, add a little Grita and advise it. So it is very, very, very effective form.
Thank you, sir. Yeah. Next question is, what are the limitations of Ayurvedic management of male infertility? What can we use, or for which condition we should decide it is asadhya?
Wonderful. See, Ayurveda Shastra definitely believes upon this particular concept of sadhya, asadhya, kattasadhya, ayapya and anupukramas. So wherein Klinefelter syndromes, severe orchitis, recurrent orchitis, varicocele of very high degree like 4th degree, or microarchia, they're all asadhya prakaranas only, or in hypogonadism with the highest degree, severe obesity with the gynecomastia, there will be some problems. Whereas there are very good scopes also, like oligospermia is a very good area, oligozoospermia is also a very good area, necrospermia, pyospermia, etc. conditions, by applying the Panchakarma Chikitsa, because Maiturajanam, Vikaranam, Visheshato, Kshirasatvisho, Upayoga, Sayapana. And ultimately, here, Naivasti Samam Kinchit. So Basti should be the ultimate treatment form, because it will regulate Apana. Only the Vikalpa we have to decide as per our Yukti. Thank you.
Thank you, sir. What is the treatment to increase the normal form percentage of sperms? Is it possible for natural conception with 1% of normal form of sperms?
If 1%, that is below average only. But patient has to, if any habits like smoking, alcohol, etc., definitely we have to withdraw that. We have to prepare the patient accordingly. His ahara krama also should be, lifestyle and food also should be very well guided. Along with that, Nitya Prayoga. So for Nitya Prayoga, there are some and kalpanas, like Shugandha Avaleha already addressed, Shugandha Grita, our very simple Maharaja Prasannitaila, etc. As a food, along with the food, if they are given, so gradually the sperm parameter and its component motility they improve. Thank you.
Thank you, sir. And the next question is, Harshan is in the treatment of Shukragata Vata. What is the meaning of Harshan?
Shukragata Vata, repeat it.
Harshan is in the treatment of Shukragata Vata. What is the meaning of Harshan?
So actually, Gatavata and Avritavata. This is again a great area. Shukra Gatavata. Here, after Shukra dosha, the Vata dosha penetrates deeper into the tissue level. It can definitely change some morphological changes at the level of Shukra Dhatu, what I believe. And Aharshana is one particular area, lack of performance. Further, Garbhasrava also can affect. Because of the morphological change, because of the head defect, tail defect, etc., those can happen. So here, Vata Dushita Vata goes and penetrates deeper into the tissue area, changes its behavior. It may be from birth or later on it is induced. That way we have to look into. And in this area, whether it is sadhya, it is reversible or irreversible, a detailed study is required. Thank you.
Thank you, sir. Next question. Patient of 29 years having phimosis doesn't have any difficulty during ejaculation or coitus. Does it cause any difficulty for conception?
What about his semen parameters are done? If the semen parameters are all right, then there is no problem. So this is the natural way. Even without that also, with the naturally, if there is a premature ejaculation, the conception rate is very high only. Only the parameters we have to study. We have to go for a seminogram and look into that. Thank you.
Thank you, sir. Next question is, what is the concept of Sri Shukra?
So regarding the Sri Shukra, already the answer is given here. So Sri Shukra in the sense, what happens here, Matraja and Pitraja bhavas need to be studied at length and in depth. And probably, I believe, why our CSAM, our different universities omit Charaka Sharira. In Charaka Sharira, lots of informations are given, and there are some other informations in Shubhat Santati, Yoga Prakasha, like small compendiums, that need to be brought into the academia. Then, regarding the Sri Shukra Prakarana also, some informations are indirectly available, directly they are available. I believe these are the different hormones, they will exhibit the, show that. For example, Kesha, this is the one of the Shukra Dhatu. Definitely Sri is having a lot of Kesha. Equally, Kesha is the one of Asti Dhatu also. By that particular Siddhanta, we have to believe Sri is also having Shukra Dhatu, and Sri can deliver a male boy. Then Pitraja Bhava, Matraja Bhava, it's balanced. That area, because Ayurveda Shastra has been told Nati Sanchepa Vistharabhaya, probably that area without description went into in the textbook like that. Thank you.
Thank you, sir. There are a lot of questions and there is a lack of
you
time.
You can please mail me whenever I'm free and try to attend it. Okay?
Yes, sir. Thank you so much, sir. Thank you, sir, for so patiently answering all the doubts. With that, can we conclude, sir?
Thank you. Thank you.
And any participants, any questions which has not been clarified today will be clarified in the upcoming sessions. So that we can, with that we can conclude.
Thank you. Thank you.
Thank you so much, sir. Quoting Marian Wright Edelman, education is for improving the lives of others and to leave your community better than the
meeting.
Thank you so much,
please
sir.
Call me by 8:30. Okay, please.
Thank you so much, sir, for sharing this knowledge. With that, we come to an end of day 2 of online certificate program on clinical intervention of male and female infertility. Thank you all the participants for joining us today. Looking forward to seeing you all in the next class. Once again, thank you so much, sir. Thank you all. Wishing you all a great evening ahead. Good night.